Let's go to visual diagnosis, inspection, the cracked tongue, second part. In general, cracks indicate ion deficiency. There are many different types of cracks according to their location on the tongue. There's heart crack, single stomach crack, scattered stomach cracks, spleen cracks, central lung crack, bilateral lung crack, stomach lung cracks, ice flow cracks, kidney cracks. The location of the cracks, therefore, allow us to identify which organ is affected by ion deficiency very clearly. Please note that not all cracks always indicate ion deficiency. For example, a shallow heart crack indicates a constitutional tendency to mental emotional stress. Bilateral lung cracks indicate a past disease of the lungs, usually dating back to childhood. Cracks can become shallower with treatment. In general, cracks indicate ion deficiency. Like we can see here in these pictures, the heart crack, the stomach crack, and more stomach cracks that are more scattered, and the stomach heart crack that goes all the way down from the middle to the tip. In general, cracks, because these cracks indicate ion deficiency, the tongue is also pale and swollen. So we can see the lung crack on these first two pictures, then the lung and stomach crack on the third one. The fourth one is the spleen cracks, and the old age cracks on the fifth one, and the kidney crack on the sixth. So let's look at the heart crack. The heart crack is a long midline crack that starts near the root of the tongue and extends all the way to the edge of the tip. Occasionally, it may extend to the very tip of the tongue. The clinical significance of the heart crack depends on its depth and on the color of the tongue. If the heart crack is relatively shallow and the tongue body color normal, this indicates not an actual heart pattern, but simply the constitutional tendency to mental emotional stress. In other words, when subject to the same stress, a person with a shallow heart crack will suffer more emotional problems than one without. So you can see here in all these pictures, the heart cracks, the stomach cracks, and the stomach and lung cracks. The stomach crack is a midline crack that is in the center of the tongue, which is the middle burner area. The clinical significance of the stomach crack is either a stomach indeficiency or a constitutional tendency to stomach patterns. The stomach crack differs from the heart crack in two respects. One, it is only in the center, and two, it is wider than the heart crack. The scattered stomach cracks may be all over the tongue. They are either small horizontal cracks or irregular cracks that in Chinese books are described as being the shape of the Ren character. The clinical significance of the scattered stomach cracks is either a stomach indeficiency or a constitutional tendency to stomach patterns. The lung crack is a central crack in the front third of the tongue. It indicates a constitutional tendency to lung patterns and lung deficiency. The diagonal lung cracks indicate a past lung disease, such as whooping cough in childhood. So you can see here in these pictures. A lung stomach crack is a combined stomach crack that is in the middle section of the tongue, and a lung crack because it extends to the lung area where the front third of the tongue is. Spleen cracks are very small transversal cracks on the edges of the tongue. They indicate spleen yin deficiency. Old age cracks are also called ice flow cracks. They are not common and they simply indicate kidney deficiency from old age. The kidney crack is longer than the heart crack, extending towards the root. It is also deep and it has small cracks radiating outwards from the central crack. It indicates severe kidney deficiency, usually from overwork. Thank you so much for your attention.